This is an echocardiographic study of a patient with a systolic murmur at the left sternal border. Initially, the turbulent flow appeared to resemble an intraventricular septal defect, but upon careful evaluation, it was determined that the turbulence actually originated from the aortic root and extended towards the right ventricular outflow tract. Indeed, this finding indicates a ruptured sinus of Valsalva aneurysm into the right ventricle. Unlike a VSD in adults, a ruptured sinus of Valsalva aneurysm often leads to acute symptoms, including dyspnea, chest pain, and even syncope. In this short-axis view, the use of agitated saline enhanced the right ventricular outflow tract, and the classic echocardiographic sign of sinus of Valsalva aneurysm is observed. The aneurysmal dilation creates a wind-sac appearance, and the negative contrast in the right ventricular outflow tract is indicative of the rupture at the aneurysm's tip. This transesophageal echocardiographic view clearly illustrates the shunt caused by the sinus of Valsalva aneurysm. These aneurysms can be either congenital or acquired. Congenital aneurysms are often associated with other cardiac anomalies such as ventricular septal defect or aortic valve dysfunction. Acquired sinus of Valsalva aneurysm can result from conditions like infective endocarditis, trauma, connective tissue disorders like Marfan syndrome or Ehlers-Danlos syndrome, or even post-surgical complications. In this 3D echocardiographic view, we can see the bulging of the sinus of Valsalva aneurysm into the right ventricular outflow tract. The right coronary sinus is the most common side, accounting for about 70% of cases, followed by the non-coronary sinus at 25%, and the left coronary sinus being the least common at around 5%. In this T contrast enhanced view, the typical wind-sac appearance of the sinus of Valsalva aneurysm is clearly illustrated. A rupture of the sinus of Valsalva aneurysm creates an abnormal shunt between the aorta and adjacent chambers, potentially leading to heart failure or even multi-organ failure. Without prompt surgical intervention, the morbidity and mortality rate are significantly high. This 3D TEE shows the orifice of the aneurysm. In conclusion, while the rupture of a sinus of Valsalva aneurysm may appear similar to a VSD on echocardiography, its clinical presentation, progression, and prognosis are distinctly different and require specialized attention.